You will start working with a physical therapist and occupational therapist on either the day of your surgery or the morning after your surgery. For every full day that you are in the hospital, physical therapy will work with you once to twice a day, and occupational therapy will work with you once a day. The physical therapist will work with you on basic mobility, such as getting in and out of bed, standing up and down from various surfaces, such as a chair or a bed, walking, stairs if needed, and exercises. The physical therapist will work with you to determine the appropriate assistive device to use during these activities. The occupational therapist will help you with the activities of daily living, such as bathing, toileting, and getting dressed. There are 3 different approaches in which a surgeon can perform a total hip replacement. The surgeon can replace the hip from the front, anterior approach, glute area, posterior approach, or side hip, anterior lateral approach. There are different restrictions depending on the different approaches. Anterior hip precautions include the following. Avoid excessive hip extension, moving or stretching the leg behind you. Avoid excessive external rotation of the operative limb, such as when propping the ankle up on the opposite knee. Avoid sudden changes in direction, pivoting on the operated limb, or twisting on planted feet. You may lean forward beyond 90 degrees. Posterior hip precautions include the following. Do not bend past 90 degrees. Do not twist or turn your operated leg inwards, internal rotation. Avoid sudden changes in direction, pivoting on the operated limb, or twisting on planted feet. Anterior lateral hip precautions include the following. Use a leg lifter to move your operated limb to the side. Do not actively move your leg that had surgery away from your body, sideways or behind you. Only place 50% of your weight on your operated leg. Do not turn or twist your operated leg outward or cross your leg. Avoid sudden changes in direction, pivoting on the operated limb, or twisting on planted feet. You can get in and out of bed on either side. For getting out of bed, we recommend scooting to the edge of the bed first. Bring both feet off the edge of the bed and then prop yourself onto your elbows and hands and finish scooting your hips around to the edge of the bed. To get back into bed, scoot yourself back as far on the bed as possible when you sit down, angling your knees and feet toward the foot of the bed. If you are unable to lift your leg into the bed on your own, you can either have someone help you, you can use a leg lifter, or you can hook your non-surgical leg under your surgical leg to help lift it onto the bed. Initially after surgery, lying flat on your back can be uncomfortable, so have pillows ready to support yourself under your knees. When standing up, scoot your hips to the edge of the bed or chair. The foot of your operated leg will be placed slightly more forward than your other foot. You will have one hand on the bed and one hand on the walker to stand. If your hip replacement was anterior approach, you can lean forward slightly and push into your non-operated leg to stand up. If you had a posterior approach, you will need to make sure you don't bend more than 90 degrees at your hips, so you may lean to the non-operative side to stand up. Your surgeon will prescribe weight-bearing precautions after your surgery. Your therapist will instruct you on it. You will walk with a walker for at least 2 weeks, or when your surgeon clears you to start walking with a cane or less restrictive assistive device. To walk with a walker, you first push the walker forward, Step with your operated leg, and then follow with your non-operated leg. When turning corners, do not pivot on your operated leg. Instead, pick up your feet and turn using several small steps. Frequent short walks are recommended. Use a handrail whenever possible when you are on stairs. When going upstairs, lead with your non-operated leg first, then your operated leg, and finally your cane or crutches. A family member should stay one step below, standing on your operated side when helping you climb stairs. When going downstairs, lead with your cane or crutches, followed by your operated leg, and finally your non-operated leg. An easy way to remember these techniques is the phrase, up with the good, down with the bad. You may shower when approved by your doctor. You and your occupational therapist will discuss the correct techniques for getting in and out of your shower stall or bathtub at home. We often recommend grab bars, tub transfer benches, and shower chairs to reduce the risk of falling in the shower. Step into the tub with your strong leg first, making sure to hold on to something stable. When you exit the tub, use your operated leg first. Approach the bench with your walker. Back up until you feel the bench on the back of both of your legs. Reach back for the bench with your hand as you step your operated foot forward. Lift one leg at a time over the edge of the tub as you scoot your hips along the bench. Your physical therapist will teach you a few basic exercises to do from after your surgery until you go to outpatient physical therapy. Ankle pumps. Move your ankles up and down. This will help to prevent blood clots. Heel slides. While in bed, slide your heel towards your buttocks as far as comfortable and slowly back down. Glute squeezes. Squeeze your glutes together. Hold for a few seconds, then relax. We hope you find this information helpful, and we look forward to meeting you and delivering an exceptional experience.